Hello, my friends. Today, we'd like to show you how to explain the health report by HRA, and we have the examinee, who is the female, about 60 years old. Now, please come into the details. Now, let's check the assessment report. On the left, it is the image that the device simulates based on the current physical condition. Different colors indicate different functional states. The best color is green, and indicating the organs and systems are healthy and balanced. These areas with the color change all indicates that the organ function has been abnormal, which needs your attention and improvement. If they are ignored, disease will come soon. On the right, we use the bar graph to show the current disease risk level of body systems. The higher the bar, the greater the risk. The absence of bar indicates no health risk in according system. In terms of the overall results, what you should pay the most attention is the digestive system. Now, let's start the liver and colon system. From the screen, it is clear that the liver and the cholecyst region appears blue, and the image is flashing. Flash is the highlight in our system, which means that your liver and cholecyst are clearly in a declining situation. In conditioning the index, your transaminase and alkaline phosphatase are both in an abnormal upward trend. The liver is the most important organ for our body to metabolize fat, and its continued weakening will lead to the imbalance of our lipid metabolism. In terms of the result, your fat metabolism is also obviously on a downward trend, resulting in the lipid accumulation, which cannot be metabolized. That is your current health metabolic disorder. Given these conditions, it is significant that you now have the risk of fatty liver and lipid accumulation. This phenomena will lead to the abnormal increase in blood lipid. So this is also risk in blood lipid. On the DAX, your LDL, that is cholesterol, is also abnormal rising. So I suggest you have a detailed examination on liver and cholecyst, especially on the biochemical examination of blood lipid. Besides of liver, the pancreas is also clearly showing a trend of declining. As you can see, the pancreas region is also dark blue and flashing. It indicates the declining of pancreatic function, which will lead to abnormal secretion of pancreas and affect the metabolism of glucose. Insulin is also significantly abnormal above normal range in terms of hormone level. So taken together, there are disorders in your glucose metabolism. I suggest you monitor the blood glucose situation. Might as well to go to the hospital and have a detailed screening for glucose tolerance. Your digestive system. The stomach and intestine is also in a downward trend with different degree of blue visible from the picture. The continuous gastrointestinal function weakening will lead to the occurrence of gastrointestinal disease. Some symptoms will occur, such as bloating, stomach pain, and diarrhea. In view of such results, we suggest you adjust the diet, avoid the cold and spicy food, and take light and digestible diet. Meanwhile, the degeneration of cell remains you to focus on the liver and gastrointestinal tract. Since there is a tendency of pathological development, I suggest you take a detailed examination of liver and gastrointestinal tract in hospital. You could take a gastroscope, confirm whether there were lesions. In addition to the digestive system, there are other things you should be aware of as well. Now come to your cardiovascular system. Most of the myocardial function is fine, pale and gray. However, in the superior and inferior vena cava and the right ventricle region, dark blue appears clearly, indicating the lack of blood reflux, which obviously lead to a lower limb circulation problems. You will suffer from lower limb pain and stiffness, and I suggest you soak your feet yearly, raise your right leg to promote blood return. Clinically, cardiovascular is related to the cerebrovascular system. The inefficient circulation of the heart will also affect the blood supply to our brain. Our systems especially reminds you that there is a circulation disorder in the intracranial vessel, so let's take a look at your brain. It's clear that the temporal lobe is blue. The frontal lobe is yellow. And this is an indication that there is some deficit in the intracranial blood supply, combined with your cholesterol situation. This is the cholesterol situation, and combined with this situation, the risk of blood clot is very high. You should pay attention to the prevention of blood clot. And in addition to that, please pay more attention to your respiratory system as well. As you can see, the entire respiratory system indicating the trachea, bronchi, and most of the lobes of lung are also showing a tendency of decrease. At the same time, the cellular function degeneration of your system also highlights the tendency of pulmonary function change. So I suggest that you undertake detailed examination to the lung, respiratory tract. Might as well do a chest X-ray to check whether a respiratory tract has a pathological change. Avoid illness aggravation. For skeleton system, there are different degrees of blue from the cervical vertebra to the entire sacral tail, indicating that your joint vitality decreases and you are prone to stiff pain. At the same time, the system remains that your bone density has been reduced. The bone density reduced, and the decrease of bone mass will also increase the risk of osteoporosis. Therefore, it is recommended that you take proper calcium supplements, and do more exercise to improve deposition and strengthen bone function. So this is the whole situation. And what you need to focus on are, first, a detailed examination to the liver, cholecyst, gastrointestinal tract, and the lungs. Including the pathological condition, you can make physical therapy adjustment later. And please pay attention to your cardiovascular system and neurological system. In addition to this, you should also pay attention to improving the bone function, including the blood flow, doing more exercise appropriately, and proper diet and rest. And of course, after the examination, we can print out the paper report for you. Every examinee will get a health report like this, and nearly all of the biodata and the health risk information are included in the paper report. And also there will be the 3D image screenshot in the system as well. And at last, we will have the suggestions about the examinee's daily life, and also we will have the doctor's advice for the clinical examination and the health suggestions. And all this is the details about the paper report. Now I finished the report explanation process by HRA for this lady, and this is also the whole explanation process by any case by HRA. Thank you for your attention. Bye.